Well, good morning, everybody. My name is Katie Riata, and I am a clinical trainer with Dermaspark. And this morning we're going to be visiting microneedling, in particular the Twist microneedling system. Just before we get into it too much, I just want to give a little bit of a brief history on microneedling and where it came from. Microneedling, as you can see on our first screen here, it was made by Dermaroller in Germany, and they've been busy doing microneedling and experimenting with microneedling since the 1990s. Why they got into microneedling to begin with is they were working with a burn unit in Germany, and what they were trying to do is convert scar tissue, which is parallel bar formation collagen, into collagen type 1 or non-scar tissue, which is like that beautiful mesh type collagen that we're born with, and that's collagen type 1. So they were trying to reconstitute scar tissue back into its normal form of collagen type 1. And back in the day, the only way they could really make scars look better is they used to use like very aggressive lasers, CO2 lasers, erbium lasers, and sort of evaporate the top of the tissue and put an occlusive product on it and pray to God that it healed properly. And what you would get is a smoother scar tissue. And of course, if you saw the ladies in the 80s that had their skin resurfaced in the 90s, their face cracks, basically. When you have that kind of scar tissue, it might look okay, but it's not going to age. It's not going to protect the same way as our beautiful collagen type 1. I always like to use the analogy, if skin was an example, it would be like if linen was skin, it's collagen type 1, and we cut it and we stitched it up, that would be collagen 2 and 3. That's parallel bar formation collagen. So collagen 1, nice mesh collagen. It has elasticity and it pulls in different directions, whereas scar tissue is very taut, very tough. And when it's trying to close a wound, scar tissue is created really, really quickly. And it just grows in any direction. It's a straight band of collagen, but it grows in any direction just to stitch you up, so to speak. And that's why it can look puckered and quite, not very nice looking. So how they were going to change this is they discovered if they create what's called an atraumatic wound, which means no trauma, in the tissue to the bottom of the dermis, and they did this with a needle, they would just sort of go through the needle, through the tissue really quick and then pull it back out. And in a method that's atraumatic, meaning no wound, the skin would close and just coagulate, and it would not be, it wouldn't be necessary for the body to regenerate new scar tissue because there was no open wound. So the body would basically say, well, I don't like that very much, and it would start to regenerate new collagen type 1. So they were breaking down the scar tissue with these atraumatic needles, and the body would respond by just thickening itself, but thickening itself with an appropriate collagen. So the other collagen would dissipate because it's all broken down with needles, and we would have a new generation of collagen type 1. So as they would do these treatments, the scar would fade and fade. And of course, they've been doing this since the 1990s. And they have tons of studies on it. If you go onto the NCBI site, I don't think, like, you'll see all the original studies done by a gentleman called Horst Liebel, and he was the founder of Dermaroller in Germany. And his stepkids own the company and run the company now. Michael Tumoris, he's the owner. He's the stepson of Horst Liebel, and his stepdaughter, Alexandra. She has her PhD in microbiology, and she does a lot of scientific studies, etc. She was involved quite a bit into the business. So it started in Germany. They invented microneedling, and their applications and treatments are really based on scientific study. So you'll see as we go on how our machine is configured compared to other pens, so to speak, is significantly different than what we created, what's on the market now. So we've had many generations, actually, several generations of microneedling. They do the rollers, and there's a lot of misinformation on rollers. If you have a properly done roller, it is great for skin. That's how all of our original clinical studies are were done with rollers, by the way. And we still sell rollers to hospitals. Sunnybrook Hospital uses them in their for hypertrophic scarring and things. So a proper roller, it's just you don't see them on the market because they're only sold to hospitals and to medical facilities. How the needles are made, they're suture needles and they're gapped, and the whole entire package is a sterile product that we sell directly to like Sunnybrook Hospital or other hospitals out there. Then they had what's called the Ederma-Stamp, which is a fabulous machine all in its own. Very nice. It goes to 150 insertions per second. And it uses a spring return, which is the most common method of return for needles, and we'll get into that in a little bit. And it has only 6 needles because during all of their scientific studies, they discovered that the more needles you put on the end of a tip, the more resistance on the skin, the more trauma to the skin, and you'll end up creating the wrong kind of collagen. Don't forget, this is not just about collagen induction, it's what kind of a collagen you want to induce. So they started with the Ederma-Stamp, and they had a different handpiece on it. And then they've switched the handpieces out a few times as it evolved. And our latest version, which most of you have, is called the Twist. And again, it's a step up from the Ederma-Stamp, is particularly for dermatology and for other services. What's the difference between the two is, as I mentioned, the Ederma-Stamp uses a spring return. Well, all needling out there up till the Twist had a spring return. So the motor sends the needle into the skin, and then a spring sort of pops the needle back out. And it works well. The problem with spring return is if you're going through really deep hypertrophic scarring, it can cause drag because the spring just isn't strong enough to get up, pull the to eject the needle out of scar tissue because it's very thick and fibrous. And also the Ederma-Stamp was made for more for aesthetics, I would say. It went to a bottom of 1.5. The Twist is made for everybody, for hospitals and aesthetics alike. It goes to 2.5. That being said, in an aesthetic environment, you would never use 2.5 for anything. So what we're going to be talking today, unless you're working for a dermatology location, and I can speak to you separate about that, we're using the Twist today for aesthetics purposes. So it would be rare that you go very deep at all. Usually you're going very shallow. If you see our studies, which we're going to be going through soon enough, you'll see that even at 0.6, which is quite shallow, you're going to have a wonderful collagen induction. And short needle treatments, of course, with a Twist, great for infusion, etc. So leave the deeper depths for dermatologists, and for aesthetics, you're going to be going shallow, and I'll be going through that with you. So because it has a spring return on the Twist, I always like to say it's almost like a glorified sewing machine. It's pushing the needle in, but it's pulling the needle out. So it's irregardless of what kind of tissue you're going to. And even in shallow conditions, you're going to feel the difference. It glides on the skin. So even if someone has cystic acne scarring or scarring on the face, or you're treating gentleman's face, it just glides. It pulls the needle out, so it feels very comfortable. I had a response yesterday from a nurse that has it in near Kingston, and she was just amazed because she just did a couple of treatments, and the skin recovered so quickly, so well, and the client was super comfortable. A lot of people aren't even numbing with the Twist. And because it's retracting the needle out, the range of motion is actually much greater. So there's a greater swing. The needles are being pulled much further out of the skin than you would with a spring return. And why does that matter? When you have the skin pulled nice and taut, and you have a really nice sort of run at the skin before it enters, there's a lot less pressure on the tissue, and it feels much more comfortable. And technically, the needle spends less time in the skin. So it actually makes a big difference for comfort level. eDermostamp, comfortable, fast. It's the up to like it's the fastest machine on the market, actually, the eDermostamp. The Twist, or was, the Twist still goes up to 150 insertions per second. Because if you're familiar with the eDermostamp, we always ran it at 150. The Twist, because it has a greater range of motion, you can actually slow it down without pulling on the skin. So I'm usually operating the Twist at about 120. So here are the depths of tissue where we should be treating. So normally, if you're looking at the skin, epidermis is only 0.1, dermis goes down to 1.5, including the epidermis. And this is on average. A gentleman might be a little bit thicker. Some ladies might be thinner, and on the forehead, for instance, is very thin. So how deep do you want to treat? To pinpoint to a degree. When I'm looking at this chart, I know my depth. So if I'm doing a product infusion, or what we like to, in the market, they call it all kinds of things, nano needling, microchanneling, whatever. Basically, there are needles that are going in and out infusing product. If I'm using a cocktail of any kind, I'm going to go super shallow because I do not want to administer that cocktail deep into the skin because of histamine response. So normally on the epidermis, I might do like 0.2 in the forehead, 0.25, maybe a little bit deeper on the cheek. When you're thinking where your melanocytes are, which is the top of the papillary layer, melanocytes are very shallow. So if I'm doing it microneedling for pigment, I do not have to go deep whatsoever. I'm going a very shallow treatment. The recovery of that is going to be amazing. There's going to be no blood whatsoever because I'm going so shallow, and these needles are so fast that they feels like microdermabrasion. So it's an excellent choice for pigment treatments, etc. You can do all skin types with it. Of course, you have to go through some of the contraindications. If someone wants a little bit more anti-wrinkle, you would use hyaluronic acid only. You do not want to use a cocktail for an actual CIT Hyal, because you can end up with allergic response. So normally, if I'm going deeper into the papillary layer or the reticular layer, I'm going to be using hyaluronic acid only. And for collagen induction, you're going to be seeing a slide soon at 0.6, amazing collagen reduction. Normally, when you're looking at this, almost everybody's reticular layer is in really good shape. What really ages the most is the papillary layer. The papillary layer is the layer that is most damaged by UV. It's more susceptible to carcinogenic influence because of environment. So normally what we're treating on like probably 90% of people for anti-aging is the papillary layer, which is actually very shallow. So a lot of times you'll see people online and their face looks like a bloody mess from microneedling. There's two issues with that. Number one, it's totally not necessary. In fact, they can have too much trauma and it can work against you. And or they have the wrong kind of microneedling and it's causing microfissures in the skin, and thus it's causing too much trauma, which again isn't a good thing for your skin. So in the case of microneedling, honestly, less is more. We've had tremendous results on people skin and at very shallow levels. So it's not necessary to go deep, and it gives you as a practitioner much more control and less stress. You're not having to worry about how these people are going to recover, because the recovery is going to be very, very simple. So normally shallow needles, very comfortable, feels a little bit like a sunburn, feels like a microdermabrasion kind of, and the outcome feels like a little bit of the sunburn. And you can do a wonderful job for reconstituting collagen. So what are the indications for medical microneedling? Anti-aging that I just mentioned, great for collagen enhancement and health. Scars, which we mentioned, you're going to be breaking down those scars. Normally for scar revision, something like this gentleman here, you would go a little bit deeper because I don't know where that scar is. So I'm going to be hitting the reticular dermis a little bit more, but I'm still not going super deep. Stretch marks on the body, it does a wonderful job with that, thanks to angiogenesis. Pigmentation, again, a short needle treatment, wonderful job for pigmentation. And of course, hair growth, which is a combination of the treatment itself plus the products that we're going to infuse. So how microneedling works, we have the treatment, which is controlled damage. And it is very controlled damage. It's an atraumatic, no trauma damage. So there should not be a significant amount of blood unless, of course, you're hitting some capillaries. That happens. You might have a little bit of blood, or you're hitting a scar. When I'm hitting a scar, because all the fibers are in different directions, sometimes that can be a little bit more plasma presents, and that's totally normal. What you do is you just hit the foot switch, turn it off, sort of angle your plastics, the tip, the cartridge, and just use your tip of the cartridge to blend it in with your hyaluron. Don't let it just sit there, and don't wipe it off. Just blend it in with your hyaluron, and it's part of your growth factor serum that you're going to be using. It coagulates literally in seconds, so it typically does not continue to, it can, if depending on what the capillary is, or if they're taking a lot of vitamins, but typically it coagulates immediately. So just blend it in with your hyaluron and continue your treatment. Healing process, fibroblasts, oxygen, and growth promoting properties invade the area, and you end up with all of this beautiful immunity response into the skin. And then the outcome, of course, is new collagen and elastin is formed. You always see these purple hashtags in all of these documents, and that just represents collagen type 1, which is the mesh type collagen. So what happens, you have improved structure and function. So number one, you obviously cleanse the skin, cleanse the skin, numb the skin, cleanse it twice again. Then you sanitize the skin, and then you do the microneedling, and you create using non-traumatic needles. We create more than 1 million healing centers in the skin. How deep do you need to penetrate, or what needle depth, until you have pinpoint bleeding? And in some cases, we are creating that kind of controlled damage. I always like to use the analogy of a paper cut. You can have a significant depth of paper cut on your finger, and it doesn't even bleed unless you're putting pressure on it. And think of that on almost a microscopic level. The needle is in and out, the skin collapses, and what happens is it just coagulates. So if I'm doing deeper treatment on like a cheek, and their skin is nice and thick and healthy, you might not see any blood at all. So I don't like just going by pinpointing. As I showed you before in your screen for the depths of tissue, I go by the depth of tissue more than I do by pinpointing. You usually have it. Normally where I go for pinpointing is on the forehead. And why? Because that sort of gives me an indication of how, if the person is thick skinned or thin skinned, right? So if I'm doing someone on the forehead and they start pinpointing at 0.25 or 0.3, I know they're fairly thin skinned. So I'm going to continue all the shallow areas around the eyes, around the mouth, and even on the chin, which actually pinpoints really easy, even though it seems thicker. I'm going to do all of those areas shallow, and I'm going to do the cheek shallow, fairly shallow. I'm going to go bump it up maybe 0.3 millimeters more than that. If I'm doing someone's forehead and I find out that they don't pinpoint till 0.5 or 0.6, well, then I'm going to be doing all the treatment a little bit different. So where I'm really looking for the pinpointing is more on the forehead, because it's an indication of the tissue all over the face, than I am like every single area, you know? So, and again, I don't go significantly deep on the cheeks anyway. Why? Because as we looked at I looked at the graft of skin, like 0.6, 0.7, you're already through the papillary layer getting into the reticular. So it's not really that necessary on the cheeks and deeper areas to see the pinpointing. It should not look like that at all. I don't even like that's you see this online a lot. That's just far too much trauma. And even that to me is a lot. That is, as well, if you see her skin in general, she's very pink to begin with. So even that is significant. So when you're doing the treatment, you can see the epidermis, the papillary dermis, you'll have the vascularity right up near the surface there. So when you're pinpointing, that's basically the superficial plexus that you're puncturing into, reticular dermis. And if you're going too deep and you hit the deep plexus, that's when you're going to have a significant amount of blood. So there's difference between if I see someone, or unless it's scar tissue. So, and hypodermis, of course, you would never even get into that. So using non-traumatic needles, we create more than 1 million healing centers in the skin. How deep you need to penetrate or what deep, as long as you see pinpoint bleeding. Pinpoint bleeding looks like a red pore, does not look much more than that. The healing process, corrective healing, controlled damage allows the wounds to heal slowly and correctly instead of emergency mode healing. Puncture capillaries can bring blood platelets, immune cells, endothelial cells, and release growth factors and cytokines, which increase cellular signaling, amplify immune response. Cells that specialize in wound repair become active, migrate to the site of the wound, and proliferate. So we have this puncture, but they're atraumatic punctures. Your body recognizes the fact that it's being invaded, so to speak. And so your immune system really goes crazy. It's okay, there's been a breach in the skin. I don't want to get an infection. I'm going to send all my immune system there. And so what happens is your cytokines increase because that's your cell signaling. Okay, so your cytokine starts to respond. It triggers your fibroblasts to produce more growth factors, to produce more tissue, for immune systems to get heightened. Your T killer cells and everything else just heighten, and your body starts to just do a really nice cleanup. So it is super healthy for the skin to do this because you're heightening the immunity of the skin. So the healthy, better looking skin. So you end up with improved cellular functions, thicker dermis and epidermis, restored dermal epidermal junction and skin barrier defenses. Damaged skin is replaced with new skin that has improved structures, firmness, and elasticity. Remember, the skin keeps remodeling itself for months, up to 2 years after treatment, actually. So that is a very important thing to articulate to your clients because you know, I was listening to someone say, well, our client had this treatment a couple of weeks ago, and they said they had the best results ever, and they had tried other treatments before. And I sort of had a giggle, and I said, well, how would they know if they had all these other treatments before this one? How would they know that that was the one that gave the results? Most likely, the results came for the third or fourth treatment they had a while ago. Right? These treatments do not improve tissue overnight, just like we didn't age overnight. You'll see a result, but the result continues to go, continues to increase. So it's always important to articulate that to your clients because I don't want them buying something from the shopping channel 3 months and saying, oh, look how it did for my scars. It did nothing for the scars. It was the microneedling that they had several months ago that is really kicking in and really improving their skin barrier and the surface of the skin. So very important to tell them that during consultation. And I always like to use the analogy that when it comes to cell signaling, which is really one of the key things of microneedling, when we have a computer, for instance, and it's been running far too long, and it gets really laggy and slow, and all the communication is hampered because it's just been running too long, right? And you have, like, you know, maybe viruses and everything else, all kinds of things happening to it. And you do a reboot, all of a sudden everything works better because this communication is improved. Well, microneedling is kind of like that skin reboot, right? I'm doing a very even atraumatic wound over the entire tissue, and all of your cell communications are just totally heightened because of the compromise. You compromised the barrier, but you did it in a way that it doesn't really have anything to do because it's an atraumatic wound. So all of a sudden, your T killer cells, they'll look for atraumatic, atypical cells and destroy them, actually. So this has actually been even clinically proved to reduce the chance of non-melanemic skin cancer because it's looking for things to improve. And all of a sudden, your melanocytes is getting the instruction, don't overproduce. This is all the melanin you're supposed to be producing. Your sebum your sebaceous glands gets the message. This is how much sebum you're supposed to produce. So all of a sudden, everything is restored. All the cellular communication is restored. And there's a lot of companies out there that would like to, you know, jump on the bandwagon of microneedling, and they create what's called like human derivative products. And oh, we're going to add cytokines from a young human, and you can needle this into the skin. No, you can't actually. Number one, Health Canada has not approved any kind of stem cell or any kind of human derivative. If it says it's from a human, it is not Health Canada approved. There's very special clinical trials that they have to go through and perform to prove that it's safe. And nobody has submitted that to Health Canada. So they're doing it off-label. If they have not submitted that it's a human derivative, because I have the paperwork to show it. So, and even if that would be the case, I wouldn't necessarily want another human derivative on my skin anyway, especially a cytokine, because that's giving cell signaling boosts. And I'm uniquely me. I have my own DNA, and I have my own, my skin has its own needs. So adding isn't what's needed here. What is in just improving my own signaling network. So this is a big difference between dermal roller needles and imitation knife. We actually use a suture needle. They are not polished. That's the only difference between what our needles are and what they use in surgery. So the other ones are blade type needles. Some of them look like pins. They all cause too much trauma, and that is not a good thing. So in these kind of rollers where you see lines in the roller, those are the blade type needles that are on the right. You're causing more damage to your skin by using them than not. So you probably shouldn't even touch them. If you don't order anything from Amazon, tell your clients not to either. Show them this slide and say what's going on with their skin, because they're literally causing little cuts all over their skin, and that's not a good thing. This is another reason why we're an audited company. Most of the microneedling out there is not an ISO medical company. So we get our products pulled fairly regularly from the powers that be in Europe. And we also have our MDSAP. So they're coming in to check for the quality, make sure that it's not defective in any way, make sure that they're sterile. There's a lot of products coming in from China these days. It says sterile on it, doesn't mean that they've gone through anything. We have to prove all of these things. So they have to come in and check for and rip out our products and etc. On the back of your needle cartridges, there's a little sticker. You can take those stickers off, put them on your charts, so that if there was ever a recall, you know which batch number each needle is from. So again, this is a medical device and medical quality device, and we have all the checks and balances for defect. I love this slide. This is exactly what I'm talking about by an atraumatic wound and a traumatic wound. So when you're causing an atraumatic wound, the needle is in and out, it closes, and that's why we don't have a significant amount of blood in most cases. Microneedling gently displaces the tissue and healing, and we do it so fast, the skin doesn't even recognize that it's like, you know, it's needled. You don't feel it, that it's needled, because it's just too quick. Disc-like needles, pens that are slow, etc., cause microfissures, and that is what happens to a microfissure. It causes a little micro tear, and you end up producing an emergency mode collagen, which is not the best. This here is exactly what happens to those kind of traumatic needles, wounds. You get a little blood clot in the surface of it, and then all of a sudden you'll see the parallel bar formation collagen going sideways in that tissue, and you just cause a little micro scar. So it doesn't really look like scar tissue because they're so fine, but basically in some cases, microneedling can convert, if you didn't have the right utensil, could convert good healthy collagen 1 into collagen 2 and 3, which is not how we want to age. In the case of some scarring, even if you had these kind of little micro scars, it's still going to look better. I go back to my like CO2 and erbium laser. It's like a smoother scar scenario, and it's still going to look aesthetically better. So you can't even say with other pens that, oh, they don't have a result. They probably do have some, but it's not the result we're looking for. We're looking for collagen 1. And why we don't use a lot of needles. We only use 6 needles. And we use significantly less needles on our home rollers, and you can see why. The only one punctures at a time, and our home rollers are only for 0.2, so you can sell those to your clients. Those are great for product infusion, and they sell like hotcakes. I have derms, honestly, they order, it's ridiculous amount of rollers that they don't sell product without a roller, basically. So those are really great resource for you, especially if people are having, like, you know, pigment issues or something. They can use their home roller twice a week and cleanse the skin, roll, and then apply their product, and it just helps infuse. With pens and things, some of the machines out there are just ridiculous. They're using like 20 needles, 30 needles, and what happens is it just basically creates a lot of pressure on the skin and sort of pops through the skin, or it doesn't even enter. Like, you can set some of these needle systems at, like, you know, 0.7 or 0.5 depth, and it might go in 0.2. It just really depends on the type of skin they're treating. So it's very inaccurate when it comes to depth of needle, and it can just cause too much trauma. Plus, it's very hard with a battery operated pen to pull that amount of needles out of the skin. So it really creates a lot of drag, microfissures that you already saw. So the combination of battery and cluster tip equals not a very good treatment. Okay. And I think that's important because our machine is probably one of the pricier ones out in the market. And the reason why is the other ones are inexpensive is, one, for instance, it's Health Canada approved, but it's a white labeled machine, and it's made in China, you know, and it has huge cluster tip, battery operated, is going to be causing a lot of wounding on the skin more than helping the skin. So there's all kinds of products out there, but are they effective for the tissue? Not so much. And it's important for you as technicians to be able to explain this to your clients, why that $99 treatment at someone's, you know, place is not going to give you the good results. In fact, they'd probably save their money and not have that treatment at all. This is what the skin looks like magnified if you have those kind of treatments. Cause little microfissures and eventually scar. And that is not a good look for anybody. And I've seen that on people that have had too much aggressive treatments on their tissue. And not just with microneedling, even some of the RF microneedling, which is huge needles. They can leave almost like a pore-like scar. So it almost looks like they have large pores, except they are little tiny micro scars. So these are all the certifications we have. If you go on to MDL Health Canada, which is a very important site to go to, and not just for microneedling, for all devices, you can check on there directly and find out who has what license. You can click on an active license search, and if it has no match found, you mean it's not Health Canada cleared. And they use Dr. Pen as an example, but there's other devices out there that aren't Health Canada cleared. So one of the things, the Twist is an ISO 13485 medical quality. So is the eDermostamp, by the way. It has MDSAP, which is, we have a standard governed manufacturing protocol. So we're certified for that. We have CE mark, which is the European CE, which is it's a medical grade product, and it's licensed by Health Canada as a Class 2 medical device. It's audited for materials, products, sterility, and more. It is the fastest on the market. It does 150 strokes per second. I think there's another company out there that has a pen, and they're saying theirs is the fastest. Well, they're probably the fastest pen, and they're doing 120 strokes per second, but they're nowhere near an electrical product. And the speed makes a huge difference when you're doing a treatment. It has full power 24/7. So if you're doing 5 treatments in a row, guess what? They're all at 150 or 120 strokes per second, depending what you choose to use. These things last for years. It comes with a 2-year warranty, but unless you drop it, it's a workhorse. The Silk Touch is the technology itself shortens the, which I already explained, shortens the time the needles are inside the skin and thus minimizing discomfort. It's a huge difference. There's like some nano needling products and everything out there, and they're saying they're so much better than microneedling. And the reality is they're significantly more uncomfortable, a lot more trauma, because a lot of these stamping devices, they're vibrating in and out. So each hole is punctured like 8 times by the time you get to the next hole. And you're having to lift it up perpendicular, or else you're causing fissures. So there's a lot of products out there that are saying that are the most kind, but with the silk technology, there's nothing on the market for microneedling that is actually more comfortable with this. There isn't, absolutely, hands down. And I've sold this to derms. There's a lot of dermatologists out there, a lot of clinics that have had other products. Nothing can really touch this for comfort. Innovative handpiece, active needle retraction, which I've already talked to you about. One of the things that you're always going to, there's no tip on this slide. I'm going to show you, if you're ever audited by the health authorities, one of the things they ask right away is if you have a flowback safety system. And yes, you do. There is a set of valves in the back end of the cartridge that prevents fluids from reaching the handpiece and minimizes the risk of cross-contamination. So that is what the number one thing they ask is about that. So it is the safest medical grade needles. They're suture needles. They're verified sterile. They're optimal count. We only use 6. Some companies will say, well, we use more needles, so we have better coverage. It goes up to 150 strokes per second. So who cares how many needles they have? This is so fast. And it's less. So we actually have significantly better coverage, and it's just much more comfortable. And of course, we're sterile, disposable, and we're certified sterile. There's a lot of companies out there, they put sterile on their product. How do you know they're not an ISO? They're not audited. So they could have all kinds of issues with manufacturing you wouldn't know, or not even do it properly at all. So how you load the cartridge, and I have a little video on this. That I can send you, or Kara can send you. You literally click the little needle inside the handpiece. There's a little notch, and you just sort of place the needle cartridge there, and it pushes it in and pulls it out. Minimal discomfort during the treatments, and much more precise microchannels in the skin. No tearing, pulling, or needles that get stuck in the skin, even when treating thick burn scars. So it is pushing the needles in, pulling it back out. It's always gliding on the skin. It feels amazing. I had to do my neck in a demo recently, because the person I was going to demo was on blood thinners. So I just didn't have time to numb. I just sprayed my neck with alcohol, put a little hyaluron on it, and away I went. I was doing probably like 0.75, and it was the most comfortable thing ever. So now I want to continue with those treatments on the neck, because lots of times the neck is a very sensitive area, and it was comfortable, no numbing or nothing. So feel free to use it on yourself, ladies, because it's so comfortable that you don't have to go through the whole protocol of numbing and things for yourself. Just treat yourself and you're good. Also, the recovery time is better because there's less wounding. There's no wounding to the skin. It's atraumatic. This is just the idea of the twist has a longer stroke, and thus the time span. It has more of a run on the skin. If you're getting an injection and someone just hovered a needle over your arm and then pushed it in, it would hurt. If they pull the skin and they dart it from a distance into your skin, it really feels much more comfortable. It's the same principle. Mechanisms of skin repair. First, we have neocollagenesis, which is the collagen production, epidural renewal, angiogenesis, which is creating new blood pathways, and melanogenesis, the creation of melanin. Neocollagenesis is the process of generating new collagen fibers. Fibroblast activity declines with age as the cell becomes dysfunctional. And in medical literature, microneedling is referred to as collagen induction therapy or percutaneous collagen induction. On average, an increase of 206 fibers in increase in fiber content 6 weeks after one single treatment. That's huge. That is amazing. Microneedling triggers rapid proliferation and differentiation of fibroblast cells and decreases the production of collagen elastin gags, which is like your hyaluron products, etc., in the papillary region of the dermis. So when you're looking at this biopsy on the right, the top is controlled. I showed this to somebody the other day, and to a class, and I didn't explain myself very thoroughly. The purple dye is always indicated of the collagen type 1, new collagen, right? So the top is the control biopsy. That's what our skin looked like before. We did a biopsy on the same tissue after needled skin 6 weeks later. And that needle depth was only about a 0.6. Look at the quality of collagen. Look at the increase. It's beautiful, beautiful, beautiful result. And of course, those you can find on those studies you can find on NCBI. Horace Liebel, you see Liebel H, abstract reflections about collagen therapy, and that was done in 2006. Again, these guys were at it for a long, long time. Then there was another study by Horace Liebel and Klaus Luther, both Germans, and they were submitted these. These are under the peer-reviewed for microneedling. Again, they were the founders of microneedling. So beautiful result. So this is amazing for any anti-aging routine. And again, shallow needle. Epidural renewal, as the cell turnover describes the natural life of keratocytes in which they push upwards, squeeze, flat die, and flake off. Proper cell turnover is necessary for keeping the epidermis healthy, for maintaining the integrity of the skin barrier defense system. And the process declines with age and UV. Microneedling promotes rapid proliferation and differentiation of basal keratocytes, normalizes cell turnover, thickens the epidermis, and restores the dermal-epidermal junction and skin barrier defenses. So what happens as we age, our cellular turnover is really declines, and you'll often see seniors with more like thinning skin, etc. And people would think that that would be a contraindication for microneedling. You always have to check blood thinners in someone that's getting older, because a lot of people are on blood thinners. Even have to check a little bit of their supplements, because that could be blood thinning, and that wouldn't be a necessarily contraindication, but they're definitely going to present more if you're doing microneedling on them. But in the case of someone anti-aging with thin skin, you can do the treatment quite effectively, but just do it really shallow. Again, less is more. If you're just doing like maybe 0.25 on their skin, maybe 0.4 on their cheek, 0.3 on their cheek, they're going to have a really nice result. Their epidural layer is going to renew. It's going to thicken. It's going to have a better functioning. Also, just to remind you, we're puncturing the skin 1 million times literally in one treatment. So it's acting sort of like a peel as well. So they're puncturing the layers of the stratum corneum, and that starts to shed a little bit. Normally, if I'm prepping someone for microneedling, for some of you that have the Oxygeneo, I love the Oxygeneo to go with microneedling. I usually do it about a week before, just to get rid of all of that excess stratum corneum. Why? So they don't have so much flaking during the microneedling. Plus, you're cleaning out all the pores, etc., and really making the skin nice and healthy and prepping it properly for microneedling. So really great for thinning skin, which you wouldn't think would be an ideal candidate, but it is. I just do it a very fine, easy, not a lot of repetition, very easy peasy kind of treatment on them, a very shallow needle, and they're going to have a really nice result. You can see here, young skin is nice and thick, and obviously the tissue of the aging person is thinner and more compromised. Melanogenesis, the process through melanocytes produce melanin. Hyperpigmentation is a result of excess melanin production by hyperstimulated melanocytes. Microneedling reduces the appearance of pigmented lesions by promoting rapid differentiation of basal cells, restoring the dermal-epidermal junction, thickening the dermis and epidermis. Moreover, microneedling is proven to suppress the expression of pro-melanogenic genes. Optimal results are achieved in combination of fusion of anti-melanogenic ingredients. And when we're talking about it, we're not, if you have to, we have a product for pigmentation correction. And when you're using it, you can use it two ways. You can you do it shallow. I don't never want to see blood if you're using any kind of cocktail. So I would do the whole face at about 0.25. And if you think, well, that's really shallow. What is Fraxel, for instance? It's like 19 something nanometers, which is like 0.2. A lot of our fractionated treatments out there, when you're thinking of a laser, like an IPL, what is their depth, right? It's like it's 400 and something nanometers to 1200 nanometers. Well, you're looking at 0.4 to like maybe 0.6, 0.8, you know, so they don't have to be like, your treatments are significantly stronger than anticipated, right? So with microneedling, always go shallow. And especially if you're using those kind of cocktails, these are aggressive treatments. Even at 0.25, you're getting the product right where it's needed and no deeper than that. Because again, if your immune system, which is a great thing, it gets heightened, right? Well, we don't want that immune system to come up and say, hey, what are you doing here to some foreign substance, right? So there's a lot of companies again out there, and they're sort of wanting to infuse all of these other cocktails, but the problem is our immunity doesn't like it. So always go shallow. We have a beautiful pigmentation treatment. Don't want to see any blood. Okay. Angiogenesis. It is probably one of the most important functions in my mind of microneedling. As we age, our capillaries, you know, get dysfunctional. Some of them collapse, and then the blood has less mobility because there's a lot of areas that it used to flow that isn't available anymore. And all of a sudden, it's sort of forced to go through the remaining capillaries. They dilate. So you'll see some aging people, and their skin sort of looks waxy, and they have a lot of dilated capillaries around the nose and in different areas. And just there's a lot of dysfunctionality there. If you are having at your disposal IPL, we have IPL and we work IPL with microneedling really nice, but you always do your IPL first. You're going to be coagulating any kind of vascular anomalies. And then after you're done your series of 3, which you probably do that once a month to get rid of any vascular issues. Then after the fact, you're going to do your microneedling, and you're going to do those every 6 weeks. And I sell them a package of 3 microneedling after your laser. Why? I'm going to go out with the bad, and then microneedling creates what's called VEGF, vascular endothelial growth factor. And it's much like trimming the plant. You know, if you have a little plant and you trim it up, all of a sudden it has new branches. Very similar to all of our capillary network. We start puncturing it, all of a sudden growth factors come in, and we start creating a better blood pathway. Well, that's huge for someone that's aging. All of a sudden they'll come in like 2 and 3 treatments after, and their face is nice and pink, and they have color. And what happens is the blood actually has areas to flow now. It's bringing oxygen and nutrients into all of those areas. And the chance of it to dilate those other capillaries are really reduced, because all of a sudden it's like not one river, it's a whole bunch of little streams, right? So it works beautifully for aging skin, and all of a sudden their skin is vibrant and bright. And because of lack of blood flow, as we age, our fibroblasts become dormant. They turn to fibrocytes and just don't produce anymore. And a lot of that is just the lack of oxygen and nutrients and support that the fibroblast needs, or it's just not there anymore. And so VEGF, it is amazing for face. It is a critical part of stretch marks, actually. Of those tears and fissures in the tissue, there is no blood there. So all of a sudden, you'll start to see pinpointing in your stretch marks after a few treatments. Very important for hair growth, right? All of a sudden, you have your poor head with all the chemicals and dyes and sun and everything else that it gets. There's a lot of dysfunction in the scalp for blood mobility. And having the microneedling really helps to restore all those blood pathways. All of a sudden your hair and roots get all of this beautiful blood flow, and it's healthier, right? So you can never say enough about VEGF. The only thing I do ask is don't do IPL afterwards. Like I've seen people and I've gone into clinics and they're doing IPL, then they're doing microneedling, then they're doing IPL. And why would you want to coagulate something that I'm just trying to induce? That being said, I do not like suction products after these either. If you want to do a microdermabrasion or something like that, nice to prep the skin before you start your microneedling. However, if I'm going through microneedling, I don't want to see someone like 5 days or 10 days after doing microdermabrasion, because why would I want to use vacuum and pull blood through all of this area where I'm trying to restore healthy blood flow, right? The Oxygenale, you can use it about 3 weeks after your treatment. It doesn't use vacuum, so it's just going to flush the area out, which is great. And the oxygenation, everything else is going to help heal. Don't use suction on those, like through the process. You know what I mean? If they were younger, maybe in a few months. I don't like suction on aging skin anyway. If they're younger, you can do those kind of treatments, but later in the future, okay, when their skin is calmed down from this and is totally healed and everything's reestablished. Growth factors and cytokines. Growth factors and cytokines are crucial for skin healing and remodeling after microneedling. Small proteins, peptides, that's what they are. Our cell produces growth factors and use them to communicate with other cells. They induce cell migration, differentiation, and proliferation. And as we age, the secretion of growth factors declines, and which might impair wound healing. Also really impairs our collagen induction. Microneedling stimulates the production of specific growth factors that regulate wound healing process and increase cellular activity. TGFB3, that is the most dominant growth factor released during microneedling, and it is the growth factor that is really necessary in stimulating the fibroblasts and creating the nice mesh collagen type 1, right? TGFB3 reduces TGFB1 and TGFB2 that are associated with scar formation. Now, TGFB1 and TGFB2 create parallel bar formation collagen, right? So those two are sort of offsetting each other all the time. And where do you find TGFB1 and TGFB2? Find them in our blood, in our veins. Why? Because if you look at our heart, if you look at our muscles, if you look at our tendons, and you look at how it's formed, look at those kind of proteins. They're all parallel bar formation collagen. Meat is like, when you're looking at the tissue, it's literally linear, right? So we have a lot of TGFB1 and 2 in our plasma, which is great for muscle healing, etc., because those are the growth factors to create those kind of tissues and also scar. So it is not a bad thing. It's in our body. It's natural. But TGFB3 is more localized to our skin where it's needed, right? So when we're doing microneedling, we're producing the right growth factor in the right area to produce the right kind of collagen. Microneedling increases the absorption of active ingredients. How more active is it? And this was done actually on the roller, not even on the regular microneedling. Average topical absorption rate is 7%. When you're doing the roller, the after microneedling is 70 to 90%. So this is in between. This isn't during. If I'm microneedling a product in, it is like 200 and some % higher absorption. And that being said, that is why when we're doing like a real collagen induction, we're using hyaluronic acid only, right? I do not want to do a cocktail when I'm going deep in the skin, because I don't want a 200 and some % absorption rate during the treatment for a product that has germicides and all these other kind of things in it, right? I want something low bacterial load or less sterile. So the average topical absorption, you still have to be careful with microneedling, because a lot of our products, what does it say on a lot of our cosmetic products says not for broken skin. Well, this has been just broken a million times. So you have to be really careful on what you use for aftercare. And I do not recommend using any kind of cosmetic product during the treatment. A lot of times I'm getting texts all the time, like, what about this? What about that? What about this product? I can't speak. I'm not a, biochemist for a lot of the products out there, but I can say this: if you're going deeper than an infusion, it has to be hyaluron only. And there, if you Google granuloma and microneedling, you'll see a lot of the issues that they've had in the market, and they don't happen often, but when they happen, they're not a good situation. Is people infusing and even putting on the wrong products immediately after treatment. So normally, when I'm doing a treatment, I'm doing microneedling with hyaluronic acid if it's any depth at all, and then I'm using my hyaluron mask after, and I take the mask off and I put nothing on their skin, no sunscreen, no moisturizer, nothing. Their skin is going to continue to absorb the product from our masks, which is hyaluronic acid and a very small amount of vitamin E and matrixyl. And so those are just going to sort of rest on the skin and help the skin recover over the next 48 hours. And then after that, you can start using any kind of aftercare, because again, these are atraumatic wounds. So your skin is going to be fairly closed after 48 hours. Your absorption is going to be higher, but it's not going to have the same absorption as immediately after. And your skin by then is sort of ready to receive product. There was some studies saying that even if you put an effective product immediately on after the skin, your skin fights it. It's not even prepared to do anything with the product that you're going to infuse. So do not go Wild West on these treatments. You should be using hyaluronic acid for the first 48 hours, no sunscreen. They're not going to get sun cancer in 2 days. They should be avoiding the sun, like just sunglasses on, for 48 hours, no swimming and no sweating, all those kind of things. One of the issues I've seen, and not just with this, with other treatments, even like Oxygeneo, is like, in the summertime, they jump in a salt pool like 3 days after and wonder why their skin's irritated. So they have to use wisdom the first week of the treatment. It's not hard to do. Even if they wanted to go in the water and they just, like after 48 hours, wear a lot of sunscreen and just go up to their neck. You don't have to, or, try to refrain from getting too much on their skin. Don't go in the pool with kids, because you'll get soaked for sure. So just be careful on afterwards, and be careful on what kind of products you use for the first 48 hours. We use these kind of products. We have the natural line, which to the most part is what I use mostly for the treatments themselves. We have the mask, the recovery mask. The blue recovery mask is awesome. I think you got the Accelerus Pro in your kits, which is the higher expensive one, and it's more for anti-aging. Their mask is lovely too. I still prefer the blue mask, which is actually less expensive, and it's a simpler cocktail, less like it's made really for everybody. Like if I had someone coming in for acne scars and they're fairly young, I'd be using the blue roller mask. Of course, their cleanser is very, very gentle on the skin, and they have a moisturizer, ACE, which is made specifically for microneedling. And the products line is very simple. So if you need more information on that, I'm going to be doing a different slide presentation in the future on the Accelerus line and the natural line. So these are the treatments for the professional kits. We have the CITIL, which is the treatment that you're going to be using. It's hyaluronic acid, and it is collagen induction therapy hyaluronic acid. That's what you're going to be using for your scar treatments, your stretch mark treatments, your wrinkle and texture improvements. The hair and scalp is only for the head. And everybody asks me, what about eyebrows? We've never done a study on that. Maybe they could work on that, but not sure. So the hair and scalp. And we have the pigment correction, which is great. It's almost like a light peel. You're going really super shallow with that. It's great for any kind of hyperpigmentation. And I'm not going to get into this too much. Kara can go through some of your aftercare at your hands-on training. So a classical CIT treatment, we have the hyaluronic acid that we're going to use. We're going to use the recovery mask. You can use the Axelarus recovery mask, or go onto our app and look under Derma Roller and find the blue mask. That's my preferred treatment. The Axelarus mask has one layer and it's great for anti-aging. It has copper tripeptide and matrixyl 300. The blue mask has two layers. It has the protective blue covering underneath, which if I'm doing a treatment, I really like that because I'll fold it and put it underneath there. If I'm doing their neck and area and downward, I just fold it and leave it underneath that area. And I use the silk mask for the face. And if I'm not using it, I'm just doing the face, I just fold the little blue section up and put it back in the envelope. The envelope of the blue masks has a significant amount of hyaluron in it, and it is excellent for home care. I just roll up the little envelope and I staple it and I hand it home for them to use that on their way home. They can use the extra blue shield from the mask as a hydrator afterwards, and they can use the rest of the serum from that mask. So it saves you some money and they get some added home care. So the CIT Hyal, it's micronized concentrated hyaluronic gel, and it is used as lubricant to keep the skin hydrated during the treatment. It's important to use the hyaluron gel for a slip, but also you just perforated someone's skin a million times, they're going to get dehydrated. So it's going to keep the skin nicely hydrated. And the Pro Mask is great for anti-aging. It has hyaluronic acid, vitamin E, matrixyl 3000, and copper tripeptide, and it's made for broken skin. And the optional is hyaluronic acid with growth factors by Ready Medical. That product is awesome. It is not a human derivative. It's made in lab. However, it is peer reviewed from the University of Pavia, Italy. And it has 8 different growth factors in it, which we'll get into a little bit different. But as we age, our fibroblasts convert to fibrocytes and we just don't produce growth factors. This is a sterile product. You attach the 2 syringes, you blend it just 3 times. I don't want to mix it up too much and get my hyaluronic engorged and it doesn't absorb well. It's a micronized hyaluronic acid, so all different molecular structure because it's been sonicated after it was already produced. And that adds growth factors to someone like me that's age compromised. I don't produce growth factors like I used to, so I use this every time I'm doing microneedling on myself. It's a sterile product, very kind. I can needle this in. Why? Even though it's a cocktail, because it is a growth factor. And it's been clinically proven to be, it's like a bioidentical growth factor. It's clinically proven to be 100% comparable to our own native growth factors. So it's not something our body's going to resist. In the contrary, all of a sudden it's going to be infused with growth factors and start producing collagen and doing everything it wants to do. There's even VEGF in this product. So all of a sudden it's going to get that vascular endothelial growth factor that I might not even be producing myself, but I'm adding it to my skin. So it is an awesome, awesome, awesome treatment. Can't say enough about it. Those are the other sterile products that we have. There is our growth factors with 8 different growth factors. We have our vitamin C, which would be an infusion. We use this a lot of times after RF needling because the needles are coagulating the tissue. And if you were going to use it in clinic for microneedling, it'd either be applied on after the treatment. It is a sterile product. It can go on broken skin, or you'd have to needle it in shallow because it's vitamin C. PDFPA and acne complex. If I'm doing microneedling and someone has some mild to moderate acne and I'm sort of going around any area of inflammation, I can add on my acne complex after. Why? It kills P. acne bacteria for 99.9% for up to like 2 days, basically. So it's basically sterilizing your skin and it's really reducing any inflammation. So, and normalizing sebum. So great treatments to add with your treatments. So this is the anti-aging with growth factors, and it's basically going through what growth factors does. They're signaling molecules, and so they send a signaling to whatever targeted cell, say it's your fibroblast, and it's going to tell your fibroblast what to produce. and how to do it. So it is very crucial for producing more collagen, and that's why I like to add it to my skincare. So what's in the Ready Medical with growth factors? You have fibroblast growth factor 1, which stimulates dermal fibroblasts, increases production of collagen, elastin, hyaluronic acid, and fibroblast growth factor 2, which stimulates fibroblasts, increase microcirculation, and promotes scarless wound healing. The keratinoids growth factor, so this is great for somebody that has compromised surface of the skin, promotes the rebuilding of the epidermis and a strong, healthier skin barrier. Insulin-like growth factor, which activates fibroblast keratinocytes, increases cell proliferation and migration. Epidermal growth factor, EGF, plays an essential role in wound healing, stimulates cells in the dermis and epidermis. Again, great for someone that has a surface issue of their tissue. VEGF, which I've already gone through, and it's like amazing. TGFB3, again, creates that wonderful mesh type collagen 1, and copper tripeptide increases the secretion of other growth factors in the skin and has strong antioxidant, anti-inflammatory properties. So this is amazing. If you have someone that's doing microneedling and they're in their 50s or 60s, I would just automatically add this to them. It's going to be an upsell on your microneedling by about $120 because the stuff isn't cheap. It's sterile, and it's about $56 a treatment per box. So it is a really nice tool in the toolbox for anybody that's aging. Then we have repair and healing. This here is, again, a really great treatment that you can add to microneedling. Or if I had someone coming in with really bad acne, I would add this to it because I don't want to do needling on them. I want to prep their skin. This is designed to accelerate the healing process of damaged skin following more aggressive treatments. Strong lasers like laser tattoo removal or resurfacing or whatever, strong chemical peels. The active ingredients PFD and PA are completely sterile and safe to use on treated skin, so it's good for open skin. Reduces downtime, inflammation, irritation, non-scarring wound healing, control and immune response, repair of damaged proteins. This is something, I don't carry a lot of it, but I always say have 1 or 2 in your clinic. Why? If someone ever had a burn from a laser, if someone ever had anything go wrong, it might not even be from your clinic, they walk in and they have some issue, you put this on, it heals significantly faster. You can see the control with the post-treatment applications. It just totally flatlines inflammation. So because it does that, it's the chances of PIH and everything else are really reduced. So this is figure 1 is just shows how inflammation is reduced and after 24 hours after treatment. And I can tell you stories on this. It is amazing, amazing product. So how does it work? The perfluorine Declan holds like roughly 50% of its own weight in oxygen that it gets from the atmosphere and applies it to the wound, and that expedites healing, reduces irritation, erythema, and after they use it after a tattoo, so you can continue with your tattoo removal without excessive damage. So they've used this particular ingredient for wound care, even for liquid breathing. They're doing experiments with it because you can literally inhale a liquid and not drown. You can literally use it like you can have it in your lungs and it doesn't do any effect because it holds so much oxygen. It's just a very unique molecule. And they're using it even in trials for artificial blood. So because it holds oxygen and it can flow like blood. So it's a very unique ingredient, and it's privileged to carry this. We also have the repair and healing, which is the Felis aguilata, and it behaves very much like a steroid, except it's not a steroid. So you see the steroid ring skeleton. It's exactly basically the same with the PA. And again, when you're looking at the inflammatory conditions on the side, it just totally flatlines any kind of inflammation. So you can have an inflammatory response and put this on, it's going to respond like a cortisone without being a cortisone. So if someone came in, cystic acne, I'm not going to touch them with much of anything. Very light cleaning, maybe some extractions if necessary. And I'm going to put this on even before I'd ever use my acne. Why? Because the strong anti-inflammatory of the steroid plus the oxygenating portion of it just annihilates any kind of bacteria, not just P. acne bacteria. So you can mix and match this for acute treatments. We have the hyaluronic acid with C, which is really great for antioxidant. I don't needle this in typically. I'm using it after needling because, again, it's vitamin C. I've used this a lot with RF needling. I've never had an irritation, and I'm very sensitive with vitamin C. And so it is very strong antioxidant. It helps reduce UV damage. So if someone was like a smoker or spent too much time in Florida, really leather beaten skin, you can do a short needle treatment and put this on, and it is going to really brighten and lighten and benefit the skin. It's really great for UV. Then we have our acne treatment. It's acne bacteria growth by 99.9%. And you can see here the bacterial load in the tissue, 6 hours after treatment, 24 hours after treatment, it's still flatlined. It's like it really lasts pretty much 2 days. And so someone that's coming in fairly regularly for your acne treatments, if you're adding this to it, it just annihilates the bacteria. It's really giving the skin a chance to respond. And you don't have to worry about cross-contamination. You can add this to any treatment, not just microneedling, right? So even if you're doing like a peel or a oxygenate balance, you can add this as an add-on after the treatment, after your extractions. And now we're getting into our pigment control, and this is for hyperpigmentation. You have a box of seven ampules in each, and you have your lotion at home, which has ACNE and niacinamide in it. And you do these treatments, short needles. I'm normally doing a short needle treatment because it's not like a CIT. Like you can call it nano needling, short needling, however you want to market yourself, micro channeling, whatever, however you want to market yourself. You can use it once every 4 weeks, not once every 6 weeks. Normally, if we're doing a CIT, it's a deeper treatment, and that has to take a longer recovery in the tissue. So I'm doing a regular collagen induction therapy or microneedling treatment every 6 weeks. If I'm doing a short needle, it's every 4 weeks. So what is in the serum? Well, what's in the bright lotion? Well, in the bright lotion, we have niacinamide, citric acid, phytic acid, vitamins A, C, and E, apricot kernel oil, and we're going to get into all of this soon, caprylic triglyceride, and bisabolol. And in the serum that we actually infuse, we have niacinamide, salicylic acid, mandelic acid, phytic acid, hyaluronic acid, licorice root extract, Indian gooseberry extract, white mulberry goose extract. Big cocktail, deals with pigmentation on different levels, and do not needle this in deep. It's like 0.25 everywhere, basically. So what's the mechanism of action for this product? Tyronase inhibitors is white mulberry, licorice extract, Indian gooseberry, salicylic acid, citric acid, vitamins A, C, and bisabolol. How they correct pigmentation is they inhibit the activity of the primary enzyme in melanogenesis, and therefore downregulating melanin production. We have the melanin transfer inhibitors, which is niacinamide and vitamin A, and that keeps the melanin from coming up into the keratinocytes. So it hinders this transfer of newly produced melanin up to the surface where it's more visible. We have the antioxidants, which is almost all of them. And thus, this is an excellent, excellent treatment for anybody that just wants skin brightening or is just in an anti-aging program. This is like really fast recovery because it's used short needle. Your skin is just glowing about 4 or 5 days after, and your products you use afterwards is just right through the roof. And you as a technician, it's like easy peasy. It's like, you know, you're doing a short needle treatment. This feels really comfortable, almost like a microdermabrasion. They're going to get a really good shed. It's almost going to be like a peel. And so this is just doing everything for your skin. Reduces sun damage and pigmentation by reducing oxidative stress. And some people numb with it. If you have the twist, you barely have to numb with it. You're just telling them like this is a stronger treatment. They actually almost like the fact because they're paying a good dollar for this treatment, right? It's not cheap. It's still like $300 something treatment. You don't necessarily have to go through the numbing. I would still do a recovery mask on it. So you're probably still selling this for like $350, but it's a lot faster treatment, and they can come in every 4 weeks for this. So you can sell them a package of 3, have them come in every 3 weeks, especially if they're having an event and they don't want to go into deeper microneedling because that has a longer recovery, right? So they have a wedding coming up, they can have these every 4 weeks. Their skin's going to look awesome. Okay. Cellular renewal. You have cellulosic acid, mandelic acid, phytic acid. They exfoliate damaged cells, promote proliferation of healthy non-pigmented skin. So between this, doesn't have the same pH, doesn't have a really low pH, but because you're using needling, it doesn't need to be. So it's almost like a peel. It's wonderful. 24 hours after treatment, you're using your Hydron products. I'm always saying 48 because I have really sensitive skin. So even 24 hours after, I'd probably still using my masks. I actually have them, I ask them when they have the mask on at the treatment, it's like miraculous. 80% of the redness is gone after their mask. So I often say to them, would you like to buy some masks for aftercare? And they retail for about $19, $20, something like that. I think their cost is like $9. So I sell them masks for aftercare, and they buy them up, and their skin is wonderful because I show them how to use their mask, how to separate the layers, and they're going to be masking at home, and their skin is going to look just plump and perfect. We also have hyaluronic acid ampules. You can give them for home care, or they can buy the hyaluronic acid dispenser pump with the roller. We have a home roller that they can use, but those are primarily our home care products for aftercare. And afterwards, they can use their cleanser. After 24 hours, you can use your cleanser and your serums. But you still wouldn't put you can use as mineral powder at SPF, but I still wouldn't, for 48 hours, do much. Like you can use your cleanser after a day, but after that, I'd be very careful of what I use for about 48 hours. Professional hair growth treatments. So why do we lose hair? Hair loss is multifactorial. We lose hair due to natural aging of the skin, scalp tissue, sun exposure, nutrient deficiencies, harmful chemicals used for hairstyling, pollution, diet, nutrition, stress, and more. However, the #1 factor of hair loss is hereditary imbalanced hormone activity in the follicles, meaning genes, and especially pointed out the hormone called dihydrotestosterone or DHT. So that affects men and women. Hair loss begins when testosterone is converted to DHT by an enzyme called 5-alpha reductase, in the dermal papillae. It's hypothesized that the DHT blocks essential receptors on the follicle cells, which inhibit follicular epithelial cell proliferation, which cause a premature anagen to catagen transition and prevents hair growth from growing to full potential. The process continually shortens the anagen phase of the hair cycle and causes miniaturization of the follicle, leading to hair loss. So you'll see here on the bottom, the processing, the hair is basically shrinking away from the vascular network, and eventually it dies. So if a person has, like they have fine hair, this gentleman, that's not a problem. If they have no hair, there is nothing you're going to do for them. They're going to have to just simply get a hair transplant if they want hair, or shave their head. They do not have, you can't help them with that. So treating hair loss with microneedling, we do the treatment and it creates our hero VEGF, which creates angiogenesis. And we also have an enhanced fusion of therapy, and we end up with healthier skin, healthier roots, and thickened area so that the root is better grounded into the tissue. So we have hair and scalp treatments combined for professional home care. The kit contains 4 hair repair ampules and 4 skin rejuvenation ampules, and a bottle of lotion that they're going to be using at home. So that's your kit. That being said, a lot of people come in. I know myself, I've had just the odd treatment here and there and end up with better hair. Women that just want better, more luxurious hair, you can just have a couple of treatments on your scalp here and there. Even I'm always telling people, like a lot of times they use it as an add-on. They'll do their face, the woman's doing their face, and while they're masking, they'll say, hey, for half price, $200 instead of $400, I'm going to do your scalp. And you're going to be just relaxing with your mask. I'm going to alcohol your scalp and do the hair lotion, the hair serum on your scalp. And in probably 2 months, your hair is just going to be better quality. If they did that add-on with their facial treatments, they're getting their face every 6 weeks, and you do the hair add-on. Their hair in 6 months is going to look significantly better. It works really, really well, wonderful, and I can attest to that. For guys, it's a lot more work because they have a lot more testosterone to deal with. So they have to be more on a regime, and you'd have to sell them the whole kit of 8 with the lotion. So women, we have it easier on this regard. You can do us here and there, and we're going to have a nice, just better quality hair. And if a woman does that like 3 times a year, something like this, their hair is just going to age better. They're going to have just more beautiful hair. And who doesn't want that? Because once you hit 50, your hair starts thinning. Who likes that, right? So really great treatment to offer. So what's in the ingredients? So we have ginseng extract, which anchors the root of the hair follicles to the scalp and blocks DHT. We have caffeine, which is a powerful antioxidant, stimulates blood supply to the roots and blocks DHT. We have saw pomelo berry extract, which is one of the most effective natural DHT blockers. If you Google saw pomelo berry, there's a lot of plastic surgeons and derms and things out of Hollywood. This is their new, like, guru kind of ingredient for anti-aging, because it really works well in our skin as well, actually on our face. So saw pomelo, huge DHT blocker. DHT ages our face as much as our hair. That's unfortunate, but that's the reality. Saw pomelo, a huge fighter against DHT. We have copper peptides, which is a DHT blocker, promotes growth factors and strong antioxidants. We have biotin, which boosts the production of keratin and reinforces hair structure. We have B vitamin complex, which is the best group for hair loss. B vitamin stimulates blood supply to the roots, increases keratinocyte activity, and we have amino acids, the building blocks of keratin and other proteins that help support healthy hair growth. We have corn extract, which improves blood flow to the follicles. It's a natural emollient, moisturizes the scalp and hair, and keeps the hair follicles hydrated and nourished. Rosemary oil. We have studies proving rosemary oil as effective as minoxidil. Works the very same except less irritation. So rosemary is essential oil known for its ability to improve cellular regeneration, blood circulation in the follicles. We have clary sage, which is an essential oil, helps balance scalp oil, so increases cellular metabolism. We have vitamin C, which is a very strong antioxidant, also helps to create collagen, important for part of hair structure. Hyaluronic acid enriches the scalp with moisture and helps keep the follicle well hydrated. Grapeseed oil, which is rich with vitamin E and linoleic acid, which helps hydrate the scalp and stimulates hair growth. It's a lot of ingredients in those cocktails. Okay, so how we do them, you can do 8 bi-weekly sessions if it's a gentleman, and you're not going any deeper than 0.5. There is no blood in this. Again, it's a cocktail. 0.5 in the scalp is a little bit thicker, and it doesn't feel like anything, nor you don't numb them. You just, they come in with shampooed hair. You spray the hair with alcohol. Number 1, to lower the bacterial load. And number 2, to wet the hair. So when you're breaking your ampoule and you're dripping it on the scalp, it actually gets to the scalp. I've seen people barely give the hair a kiss with alcohol. And number 1, you should be sanitizing that. And number 2, it just gets absorbed into the hair itself. It never reaches the target area, right? So you're alternating for gentlemen. This is more for a gentleman or a woman that had really poor hair. You're alternating your treatments every 2 weeks. And they're in between treatments. They can use their dermal home roller and their hair lotion, and it works amazing. Possible side effects, really nothing. I haven't touched wood here, really seen a side effect. I think many years ago, someone put something on their skin, and it was a vitamin C derivative, and they had some inflammation. but she gets inflamed from everything. So it wasn't such a, she was an owner. If someone with that has that kind of allergy response to everything, even the hyaluron injections she's had issues with. So there's obviously something wrong with her, immunity. So she had a little bit of temporary swelling, but other than that, I really haven't had anything. But if someone was touching it, picking it, not looking after it properly, they could end up with skin irritation. Of course, your skin's just been compromised. It does feel like a little bit of a sunburn afterwards. So that is not unusual. If they take a hot shower immediately, they will definitely feel it. So no hot showers, just keep the skin nice and temperate. On the skin, don't go swimming, don't be working out, etc. After treatments, use common sense. I like to give them gloves when I'm handing them their home care to make them take this seriously. Just use the gloves when you're touching your face, and they'll be like, because gloves are easier to sanitize. Most people don't wash their hands properly, so they can like spray alcohol their gloves, and then they're clean, and then they can apply their products. And I just sort of do that, give them a little bit of, just show them how serious I am about their home care. Persistent redness, itching, and swelling. These are normal symptoms that rarely persist more than a day. Treatments received less than 4 weeks apart might reduce long symptoms. I do not recommend deep treatments more than 4 weeks. They're closer to 4 weeks. I get this call all the time. Can I have my client? She wants to come in. Well, then you're going to have to do a short needle at 0.25, because if you're going deeper into the tissue, it takes longer for the skin to heal. And if you're doing it too close together, you're going to have skin irritation. Your skin is going to bulk back. You're going to produce the wrong collagen. It doesn't fly. This is something that has to be kind of planned, unless you want to use a short needle treatment. So long needle or short needle, that has more bearing on your timing. Okay. Allergic reaction granulomas. Microneedling increases the penetration of topical substance, there cause hypersensitivity to products. Minimize the risk by using topicals made from needling. A lot of companies want to needle their serums in, and I cannot authorize that because we get it back all the time. Sometimes it looks like pseudofolliculitis because they have like breakouts, and I'm like, okay, you had our machine, but what did you put in? Oh, but this other company said we could use this. It's a serious business. Your skin doesn't need it. Like, what are you trying to accomplish here? The reality is that microneedling, like without anything, is still going to give a really great result. Put your products on after your skin barrier is closed after 48 hours. Still going to have a great absorption. And why take the risk for clients? On YouTube, there was a dermatologist, and he was talking about granulomas. And he said these, company, the clinic, they were well thinking, and they put some sunscreen on after the treatment, and they put a moisturizer on after the treatment. They layered a vitamin C. Well, the lady ended up with granulomas. She ended up on a huge steroid regime, and her skin was basically ruined. Like, now she's hypersensitive to everything because, your skin is increasing its immunity, and you're layering all this foreign substance on it, and it senses that, so it fights against the product you're putting onto. So please just hyaluron, and then eventually go into your other products. Okay. And I always say, if you want to do microneedling, always look up granuloma. I ran into a trainer years ago, and she didn't even know what a granuloma was. And I said, well, you probably shouldn't be training on microneedling, because that is the risk. I've never caused one because I'm really picky, and I've never had any of my clients cause one because I'm lecturing them about this all the time. So as long as you're doing everything right, everything is really safe. If you're going to go all cowboy and go really deep needle treatments and put all kinds of products and substances on the skin, then you're going to end up in trouble. Just less is more of these treatments. They're easy peasy. You're going to get a good result. You don't have to be aggressive. Please don't be aggressive. Okay. So these are really good examples of very moderate treatments, and look at the results we got. So this gentleman here, he's probably in his 60s, and he had adult onset, like acne from young youth, but look, obviously very old scars. And that was 6 weeks after a very moderate treatment, one treatment. I think Leanne did that treatment, my colleague. Even on the forehead, no, it does not replace Botox. Everybody sees that forehead. Does it replace Botox? No. Botox is stopping the muscles from moving. This is just boosting collagen levels, so it looks reduced. But very nice result after one treatment. That would not be a thick treatment. And the one on the bottom is a scar. It was a burn scar. When I first saw this result, I checked in when I was overseas on the protocol for this. I thought that scar was probably recent because it looked very red to me. And so I thought, okay, that's one treatment, but how much of that would have healed on its own, even without microneedling? Well, that was actually a very old scar. It looks very red because there was a lot of vascular damage. It's a burn. And so that was after one treatment, and that was indeed an old scar. It would not have healed any better than it did. And one treatment later, it looks amazing and not a very deep treatment. So again, less is more. We're getting good results without it. You don't have to put people at risk. This here, some of them are good shots, some of them not so much. So yes, very nice treatments here. After 3 treatments down below for acne scars. I didn't even think it was 3 treatments, to be honest with you. The treatment on the side here from Ottawa Medi Spa, nice anti-aging. I don't like the lighting. The top one is very basic treatment, shallow, probably no blood or next to no blood in that treatment, and really great pigment results. And there was no big additives added. We didn't even have, that was just a hyaluron treatment actually. So beautiful result with that. And great line revision on the left. And of course it does all different types of skin. You'll see the people here having less breakouts with microneedling because it's normalizing sebum production, etc. And some more really nice treatments. More really nice treatments, especially for burns. This is just our pigment treatment, and that's just that was just the home care roller product actually. These are our hair growth results. Beautiful. The guy on the right, he's from Cambridge. That was one of our clients' husbands. The guy on the left, Montreal, I think Ellen was involved in his treatment. Guy on the left, he was one of our volunteers when I was doing a seminar in Halifax. He came up. He's the personal trainer of my colleague, or was, and that was one treatment. And he contacted us 4 weeks later, asking where he could buy the rest of the treatments because he wanted to have them. He was really dragged into our seminar unwillingly almost, and then he ended up buying a package someplace else. The one on the right is beautiful result after 6 treatments. And so you can see, I really like the one on the right here too. You can really see the follicular increase in the base of the scalp there. Beautiful treatments. Really nice. Very nice. And you often see like this, that this is 66-year-old, her hair is darker. So, and that's just after 3 sessions. So that's what I'm saying with women, we have a little bit easier. Even like if anybody had 3 treatments add-ons onto their existing facial, that's a great add-on. And that's only after 3 treatments. Again, on the right, amazing results. Amazing results. Very good stuff. Thank you for listening. If you have any questions, please feel free to reach out.